Hello and a warm welcome to the latest event at the World Bank Group IMF annual meetings. I'm Michelle Fleury, BBC Business correspondent, and I'm delighted to be your host over the next hour or so. The issue we are focusing on today couldn't be more important. The World Bank Group estimates that 100 million people could be pushed into extreme poverty because of the COVID-19 pandemic. All the progress we've made in education, healthcare, social protection is at risk. How does the international community respond to this enormous challenge? How do we protect a generation and create a resilient and inclusive recovery? To answer these important questions, I'm joined now by Mari Pangestu, the World Bank's Managing Director of Development Policy and Partnerships.
So social safety nets obviously play a very important role. And we have actually ramped up our investments in cash transfers by 10 billion, and it will continue to roll over for the next 12 months, and it's affecting 1.1 billion people. On education, we are working with 65 countries, providing technical assistance and financial support. Because, as schools have closed, you have to think about how do we deploy remote learning in countries where internet access is not something which is widely available. So you actually have to be very creative in your solutions.
Frontline workers around the world have become the heroes of this pandemic, risking their lives to protect ours. Let's take a moment to hear the challenges they face.
On the good side, COVID-19 has become a catalyst for the adoption of telemedicine. So we launched the first tele-guided do-it-yourself swab test, and that reduces the spread of infection, improves the turnaround time of results, and reduces stigmatization.
We have taken advantage of digital platforms and virtualized all our sessions and are now conducting our sessions online.
We are racing to save lives while also ensuring the vaccine is safe and effective. There is an enormous amount of data for me to observe every day, and I am working longer hours to ensure that we get this right.
Melinda Gates is the co-chair of the Bill and Melinda Gates Foundation, and when I spoke to her earlier, I asked her how women and men were being affected differently by the pandemic.
While we know that more men are dying from COVID, when you look at the statistics, it is affecting women deeply, because what happens, and we know this from good data from the Ebola pandemic, is you have these shadow pandemics. You have a shadow pandemic of domestic violence. You have maternal mortality. We're already seeing it on the rise, just like in the Ebola crisis. And as well, on the economic front, women are losing their jobs at twice the rate that men are. We know that they're not having as much access to the capital markets right now. And as well, we know that while they're losing their jobs, the burden of unpaid labor is going up, because women are 2.5 times more likely to do the unpaid labor in their house.
President Ramaphosa of South Africa, also currently chairperson of the African Union, sent us this message for a more inclusive and resilient recovery.
We have to turn this period of crisis into one of opportunity to build resilient economies on the African continent. We have to support the development of small businesses across the entire continent. We have to take advantage of the dramatic changes the pandemic has brought to the world of work by equipping our people with the necessary tools and skills to take up occupations in a technology-driven economy. It is our intention to increase and not decrease social spending to narrow the deep inequalities that exist in our respective countries.
Mirai Chatterjee is the Director of Social Security at the Self-Employed Women's Association in India, also known as SEWA. When I spoke to her earlier, I started by asking her how governments can best protect the most vulnerable, especially women and children.
I think first and foremost, the hurdle is to even understand the public health system, to have the information about what their services are, what are their entitlements, where to go, whom to approach, how to approach, These things are not known and are not immediately obvious to women at the grassroots level.
Now, let's take some of those ideas on how to protect and invest in people and discuss them with our next 4 guests.
The government developed a roadmap for reopening of the different activities in consultation always with scientific experts and private sector representatives. In summary, I would say Uruguay has established a successful management of the crisis, combining freedom with responsibility, scientific knowledge with political leadership, and a powerful combination of health, social, and economic measures based on our traditional strengths.
We started distance education on our national TV channel. The ministry also provided online education for primary and secondary students, secondary education students, and Education Information Network, which we call EBA, our online learning platform.
All of the ministers, in a sense, echoed, I think, a similar point, which is that you have to think in scale and think through coordination. And that's always, I think the challenge in any of these things is, you don't really usually start from a situation where you have the mechanisms available. So how do you pivot a big ship on a dime very quickly? And that's a challenge that's why coordination is a word that keeps coming back.
Fair and equitable access to a reliable vaccine for everyone everywhere will be an important step along any road to recovery from this pandemic. Fortunately, prospects for vaccine development are bright, with significant resources invested in research and development. But what about the manufacturing and distribution of a vaccine once available? That's something that my next 2 guests are very much involved in.
With the support of IFC, we've been investing in capacities from 2017 onwards. Vaccine manufacturing capacities are time-consuming and capital-intensive. So fortunately, we've had some facilities that we started investing 2 years back that we are leveraging now for COVID vaccine manufacturing. If everything goes well, I think by middle of next year, we hope to be able to make about 150 million doses per month.
One of the things we're also going to have to do is become innovative. I think the traditional channels in terms of getting vaccines and pharmaceutical products to Africa is not just about COVID. I think it's a broader issue. One of the things we have done is setting up modular clinics in rural areas where you set up a network of these modular clinics that can be used as points of healthcare. And we really want to invest in that and expand that on the continent, because once COVID is over, then we can use those primary healthcare facilities for further medical needs for the many countries.
What is the IFC doing to ensure that developing countries not just have access to vaccines, but to the medical equipment that's necessary to distribute those vaccines and to get them to individuals?
We created in July something called the Global Health Platform, which is a $4 billion platform that we've created to make funding available to PPE manufacturers, medical equipment manufacturers, and vaccine production manufacturers in our countries of operation. The first project that we did with a company called Biological E, which is a vaccine manufacturer in India, and they make childhood vaccines, which, if you know what's happening today, so many children are no longer being vaccinated because of the COVID crisis. So that's the first thing that we did. The second thing that we're doing, which is a little outside of our wheelhouse, is partnering with Gavi, CEPI, and others, because when a vaccine for COVID is actually created, we want to make sure that it can be equitably distributed with the help of the private sector.